Today, I am going to explain instructions to be given to the patient after giving a removable retainer. Appliance should be worn all the time, even during sleep. Remove the appliance while eating hard or hot foods, as there are chances of distortion. Remove the appliance using the clasp only. Remove the appliance only during brushing. Clean the appliance every day and after every meal. It should be rinsed in clean water after every meal. It should be cleaned with a toothbrush and a toothpaste. If you are unable to wear the appliance at any time, you can leave the appliance in water in a closed container. You may face some problems initially, like discomfort, pain or tenderness, excessive salivation, plastic taste, difficulty in speech. All those problems will be overcome in a few days if you are wearing the appliance regularly. If any part of the appliance is broken, discontinue wearing the appliance and should report to the orthodontist. You should never wrap this appliance in paper or napkins or should not be stored in pockets, as it leads to distortion of this Y component. You should not leave the appliance out of the mouth for a long period of time, and it also increases the risk of distortion. You should return to the orthodontist for activation monthly or whenever this appliance is loose. You should wear this retainer full time for at least 12 months.